I'm here to talk about the laparoscopic surgery. When we say laparoscopic surgery, it's a type of minimal access surgery. In these procedures, what we do, conventional surgeries in the abdomen, but without opening the abdomen. How we do this? Insufflate the stomach with gas, carbon dioxide, place few strategically located ports, what we call these are the holes. Through this, we pass instruments inside, and then with the help of the image projected from a camera, we do the same surgeries as done in the conventional open surgeries, but without opening the abdomen. So the advantages are obvious. Here we are not giving any cuts or the incisions on the abdomen, we are not cutting the muscles. We are doing the same surgery, the same safe procedures which we used to do inside the abdomen, but without opening the abdomen. So the stress, the surgical stress on the patient is very less. The body feels less stress because we are not cutting the abdomen, we are not opening the abdomen, the stress on the body is less. So consequently, after the surgery, the post-operative pain, the people usually are worried about post-operative pain. How do we tolerate the pain? The pain is much less. Since we are not giving the incisions, cosmetically there are no scars. So the recovery is fast in these patients. Patients tend to return to their activity much faster with the laparoscopic surgery. So the return to work is much earlier in the laparoscopic surgery. Coming to the principles of surgery, we do the same surgery as conventional surgery, either the removal of the gallbladder, the cholecystectomy, or an appendicectomy, or a bariatric surgery, or any tumor resections. All these surgeries, the principles are same as conventional open surgery. When we can achieve the same principles with the laparoscopy, with the minimal access, we advise minimal access surgery for patients. We have seen all the advantages, but the drawbacks are we are not passing our hands inside the abdomen, so the dexterity of the laparoscopic instruments is not as much as the conventional surgery. So this is a compromise. The second is we are insufflating the stomach with carbon dioxide, and for this carbon dioxide has to come out, this gas has to come out of the body through the lungs. So patient should have good cardiac and lung function. The first disadvantage, which is the dexterity, is overcome with robotic instruments. These instruments, they can turn and twist inside the abdomen. Compared to the laparoscopic instruments, these give much better dexterity. So more complicated procedures, as an advance to the laparoscopic surgery, the robotic surgery, we can do more advanced procedures with robotic surgery. Coming to the second part, which is the contraindication, patients who have poor lung function, poor cardiac function, like those patients who previously had any lung surgeries, who have bronchial asthma which is uncontrolled, these patients may not tolerate laparoscopic surgery as well as normal patients. And in these patients, these are the patients we don't advise laparoscopic surgery in these patients. With advances in anesthesia, more and more patients, we are able to provide laparoscopic surgery. So this enhances faster recovery in the patients, much lesser post-operative pain, and safer surgery for them. So these are the advantages and the contraindications which I told about laparoscopic surgery. So with the advances in the anesthesia technology and with the advances in the instrumentation, we are offering more and more patients minimal access surgery, laparoscopic surgery, making surgery less painful and faster recovery to activity. Thank you.